Good afternoon. Just like to welcome to our clinic, Bluff Road Medical Centre, the Minister for Health and Aged Care, Mr. Greg Hunt, Dr. Lucas Tutoka from Department of Health, and Mr. Tim Wilson, the local member for Goldstein. Welcome to our clinic. We were honoured and proud and excited to roll out the COVID vaccine on the weekend. We delivered 240 vaccines in a 5-hour block on the weekend. It worked really well. We were efficient. The team did a great job. I'd like to give special thanks to our reception team for all the hard work they've done the last couple of weeks, and the nursing team who were incredibly organised, and we GPs just fell into line. So very excited to be part of the solution week one, and very keen and excited to be part of the solution long term. And hopefully we can work well with the rest of the clinics and the Department of Health to be part of the solution. Thank you.
Thank you. Nick? Tim?
Thank you, Minister, and thank you, Nick, and welcome everybody to the wonderful Goldstein electorate. It's a great privilege to be able to have the Minister here at the Bluff Road Medical Centre. We have many local residents that are obviously very concerned about their health over the past 12 months, and older residents who are very excited about getting their COVID-19 vaccine. We've heard directly into the community the wish to get vaccinated, and it's wonderful to have a local medical centre with others that are part of the rollout to make sure that those Australians who feel vulnerable and have health conditions are able to get the support that they need. So my role is really to thank you to the doctors, thank you to the nurses at Bluff Road Medical Centre, Nick and everybody else who have been part of this initial stage of the rollout, and thank you also for the work that you are going to do in the weeks and months to come, because you are the front line of protecting our community and local residents. But also thank you, Minister, for taking the time to come to our community to obviously witness a vaccination, but also to your leadership in continuing the rollout of the vaccine as part of this Morrison government's program to protect the health and well-being of Australians.
Great. And thanks very much to Tim, to our doctors, Nick and Joan and Kaching, and all of our incredible nurse and reception staff here at the Bluff Road Medical Centre. What you've just done on the weekend has been happening around Australia over the last week. Our GPs have been administering vaccines already. As of last night, 120,000 vaccines administered by our GPs in 1 week as part of a broader national rollout, which now reaches 541,761 Australians, 762 after Dale's been included today. And I want to thank everybody who's brought themselves forward. I particularly want to acknowledge the work of the general practices around the country, and I'm joined by Dr. Lucas Tutoka today from the Department of Health, who will assist with the daily update. And Lucas is overseeing the general practice rollout around the country. And let me make the point that already we have over 1,000 general practices that have been delivering vaccines. An extraordinary achievement was that despite the floods, despite the inclement weather last week, every practice that was due to receive the vaccines did receive the vaccines. We've already had distributions for this week rolled out and continuing, and indeed distributions for next week have started today. So that process is underway as we expand from 1,000 to 2 to 3 to 4,000 practices by the end of April, and I think that's a very positive sign. I'd like to address events in Queensland, if I may. As people may be aware, Queensland now has 7 cases in the current cluster. 4 additional have been identified, one of which is likely to prove to be historic and is potentially the link between the initial outbreak some weeks ago and the current outbreak. I have spoken with the Queensland Minister this morning, Yvette D'Arth, and offered our support, and the actions we are taking are as follows. Firstly, we have authorised asymptomatic testing, which means that people can be tested without symptoms across the Brisbane region. That's already underway through the GP respiratory clinics, or the Commonwealth Respiratory and Vaccination Clinics. Secondly, we have authorised, and I have authorised, asymptomatic testing in aged care facilities in the affected areas of Brisbane. And I have also instructed that the Commonwealth and Queensland Aged Care Response Centre be established. At this stage there are no signs of any infections that have been transmitted to aged care, but we're taking early preemptive action to ensure that those protections are in place. As we speak, the Chief Medical Officer, who briefed me earlier today, is conducting leading the AHPPC, or Australian Health Protection Principal Committee, with Chief Medical Officers and Chief Health Officers from all states and territories. And importantly though, the message that Queensland has given is one that I would re-emphasise as well. Vaccinations are considered a critical reason to leave home. We would encourage all patients, subject to checking with their doctors, to continue with their vaccination program. So if you are in the Brisbane area, please continue with your vaccination program, subject to your practice being in a position to do so. And we understand that that is the case, and if there were any interruptions, we'd provide that advice. At this stage, as we speak, I haven't received any information. I think it's very important to put this in context. We know how to do this. Australia has had 53 days with 0 cases this year already. We know that around the world we are at almost 500,000 cases a day, after having seen a peak and then a dip over much of the last 2 months. We're now seeing global cases rise again, particularly in Europe and Eastern Europe. And so this pandemic around the world, at approximately 500,000 cases a day, continues to provide a global challenge on a scale we have not seen since the Second World War. And so against that background, the continued rollout adds to the protections. We know how to protect ourselves and to contain, but we can only be fully protected once we're vaccinated, but also once the world is vaccinated. So it's a two-part process, at home and abroad. On that front, I can advise that there have been 82,500 aged care residents who have now been vaccinated, and that covers over 795 facilities that have received first doses and 222 that have received a second dose. Importantly, to re-emphasise, our total national vaccinations, 541,761, and over 259,000 vaccinations in the last week as we have brought on board the general practice program. So I think that's extremely important, and that's indicating that this program is continuing to accelerate, as it will this week. To provide more information, I'll invite Dr. Lucas Totoka. Lucas is a public health expert who has been leading the program for general practices and helped co-design with the AMA and the College of GPs, the College of Rural and Remote Medicine and Rural Doctors Association of Australia, as well as numerous GP webinars. And what we see here at Bluff Road is what's happening around the country. Different practices are using different models, but Nick, your approach, I think, has been exemplary, and they chose to do a block vaccination model over the course of the weekend. Others will do it on a more regular basis during the week, but 241 vaccinations already, more to go, and they'll just keep going throughout the course of the coming months. Lucas?
Thank you, Minister. Thank you for having us here. It's really exciting to see the reality of the program now that we've commenced the rollout. So as the Minister indicated, Phase 1B of Australia's vaccine rollout commenced last week in over 1,000 primary care locations, including general practices like this one, GP respiratory and vaccination clinics, the Commonwealth vaccination clinics, and several Aboriginal community controlled health services, making sure that First Nations people have culturally safe access to the vaccine. General practice Commonwealth vaccination clinics and Aboriginal health services or primary care is rapidly becoming the backbone of Australia's vaccination plan, particularly in this phase of the rollout that includes older people over 70, over 80, people with underlying medical conditions, significant disability and their carers, Aboriginal and Torres Strait Islander people over 55, and a group of essential critical workers as well as healthcare workforce. No one is best placed than general practices to identify, support and provide access to people with underlying conditions, older people, people with particular vulnerabilities. And that's why we're ensuring that as many practices as possible over the next 4 weeks come online with a whole variety of models of care that we just described today, whether it's spread out during the week or in sessions over the weekend. Practices know best how to organise themselves to reach their patients. And we have seen that happening over last week and will rapidly increase in the following few weeks. All deliveries were completed, included across the flooded areas last week, with Taree getting their delivery on Friday, which really closed up that first week delivery. And as the Minister indicated, deliveries for next week, for week 3, have already completed, where we expect more than 1,000 additional practices joining from that point onwards. And then we'll continue with that rollout until we have reached more than 4,000 general practices, all the GP, respiratory and vaccination clinics and the Aboriginal medical services being fully rolled out within 4 weeks of commencement. The important thing is that we are seeing an incredible response from the public. People want to get vaccinated and are reaching out. It's really important that people understand that while we want to access the vaccine and we want to protect the community, as the Minister indicated, there are over 6 million people eligible for a vaccine in 1B, which means that everyone will get it in the next few weeks, but not everyone will be able to get it at the same time. So go online, go to the eligibility checker and service finder that you can find on the Department of Health website. If you don't find appointments or you don't find practices near you, check again in a few days, because there's more practices coming online every day. There's more appointments, thousands of appointments coming online every day. And as practices get added to the rollout, you will see more practices near you and you will see more appointments near you that you can access. What we have seen last week as well is many general practitioners proactively reaching out to their patients, to the oldest patients, to the most vulnerable from a comorbidity, chronic disease perspective patients, and inviting them to come into their vaccination. And that's part of the model of this primary care-led rollout, a combination of people reaching out to the GPs, but also being reached out by the provider who knows that they need the vaccine. So be patient, but keep checking, because more and more appointments will be available. Online, always preferred, is available, so that hero receptionists are not swamped with calls, but there are several ways that you can access that. Your GP will reach out. You can call 1-800-020-080 on the National Coronavirus Helpline if you're not comfortable accessing the internet, or directly with your GP. They'll be able to indicate when and how you can get vaccinated. The key message here is that the vaccines are available, they're effective, they're safe, and they're free for everyone in Australia. Thank you.
Thank you very much. Look, I'll start with those online if that's all right. Steph from ABC.
Thanks, Minister Hunt, for your time. Just 2 questions, if I may. First of all, what was your reaction to Anne Webster's claim that she was sexually harassed on the floor of Parliament by a current politician? And should any action be faced by that politician? And Andrew Lanning's just been on ABC Radio to defend himself. Should he be conducting such interviews given he's on medical leave?
Sure. Look, firstly, I'm not aware of the details of Anne Webster's claim. They should be immediately pursued. I think that that's very, very important, that she's entitled to be safe. Every woman, everywhere, is entitled to be safe every single day. In terms of Mr. Laming, I haven't seen his interview. I will say this, that the actions of the Prime Minister in effectively terminating someone's career are strong, clear, powerful, decisive and immediate. Okay. Claire.
Thanks, Minister. Just around the vaccination figures to date, of the last week, it seems about 100,000 or more of the vaccines were done by GPs. Does that mean that there's 100,000 jabs from 1B and that the remainder of the 540,000 report the different figures for those two phases, and when do you expect, I guess, from that 1A to be completed with both jabs?
Sure. So there's 120,000 doses that were administered by GPs in the last week. Some of those and different practices will approach it in different ways. Are booking in the Monday, the Tuesday, the Wednesday. Others are doing it in block, and so we're delighted at the administration, and particularly given the floods and the other circumstances, the pace at which that's been done. The second thing is that we'll also provide information on 1A and 1B. We do expect, as we've said, the programs will be ongoing for the simple, and this is we've said on many occasions previously, for the simple reason that you will have people who are late deciders or were ill or were not available or consent hadn't been given, that people will change their minds. So what we'll see is a progressive tailing down in those, and so far we've had an extraordinary result from 1A, and then 1B this week I think has been very, very strong. Tamsin.
Sorry, just to pick up, you can't say now how many of those jabs so far are 1A, or is it the 540 minus the 120,000 delivered by GPs?
What we would just want from the states, the vast bulk of doses, other than the 120,000 1A, we just haven't had the daily figures come through at this point in time because we were just getting the state doses. There will be some small number of 1Bs that are included in those, but essentially it's the 540,000 is overwhelmingly 1A, but for the 120,000, and we'll get updated figures once that's provided by the states, and we'll provide those. Okay, Tamsin.
Thanks, Minister. Just following on from Steph's question, is it appropriate for a government MP who's on sick leave to be giving media interviews? And just secondly, on Andrew Laming, given he's shown a consistent lack of respect for women, do you think it is appropriate that he returns to the party room, or would you like to see him resign from the Liberal Party or be booted from the Liberal Party?
Look, I will say this, I haven't seen the interview, so I don't know the circumstances, and I think it's...
Sorry, but was it appropriate that he did an interview on sick leave?
Again, I haven't seen it, so I'll respectfully wait until I have those details. Moreover, as I would say this, that the decision to effectively terminate someone's career, the action that the Prime Minister has taken was strong, clear, immediate, decisive and powerful. And it's a very strong step. Other elements are a matter that Mr Laming will have to reflect on, and I haven't seen, as I say, today's comments that you've referred to, so I'll respectfully follow those up afterwards. Okay, Tom, AFR.
Thanks for taking our questions, Minister. In February, you and Professor Murphy told us about the possibility of using vaccine rings to quell new outbreaks, a contingency plan for looking forward as the vaccination rollout continues. Is Brisbane an option, a possible candidate for that kind of use of vaccines? How would it work? What would trigger it?
Sure. Look, I've spoken with the Chief Medical Officer this morning. At this stage, given that it is a small group of 7 in total, it has not been declared a Commonwealth hotspot, but we'll continue to work with the Queensland authorities. There are very significant vaccines already pre-positioned with Queensland, and the Queensland Government has a large inventory that they are capable of drawing upon. In addition, the general practice vaccination program is continuing, and the aged care program is continuing. So importantly, that provision is there. If there were a significant outbreak, we'll be guided by what's known as the AHPPC, or the Medical Expert Panel. The Chief Medical Officer of Australia, Professor Paul Kelly, is chairing that as we speak. Richard.
Thank you, Minister. On the Queensland lockdown, do you still have confidence in Queensland Health, considering there's been quite a number of mistakes over the past couple of days, saying there were parties of 25 people when they were not? And what advice has Queensland Health given you and the HPPC on potential spread?
Sure. Yes, I do have confidence in Queensland and Queensland Health. I think that's very important that we put aside all of the partisan differences or anything federal and state. All of the states and territories have developed very strong public health capabilities. In many cases, they were well in existence beforehand. All are very strong now, in my judgment, on the advice of people such as Dr. Lucas Totoka and Michael Kidd and Paul Kelly and Brendan Murphy and Carolyn Edwards and the incredible team we have. So, and Alison McMillan, of course. So all of that work has been done. So I think they're in a strong position to protect Brisbane and Queensland and thereby Australia. And that confidence is something that is extremely important, that the nation should have, Queensland should have, and Brisbane should have. The easiest thing in the world would be for me to in some way provide a half-hearted answer. I have confidence in Queensland's ability to deal with this outbreak. Then in terms of any additional work, the AHPPC is meeting at this moment, and if they recommend, we're in a position to implement.
Yes. Anyone that's been in Brisbane since March 20 has been advised to go into lockdown for the last 3 days, no matter where they are in the country. Does that apply to the Brisbane football team as well, who are staying in Melbourne for the time being?
So the health orders are general. Specific teams or events may be subject to particular orders. So I know that the AFL is working directly with Victorian Health, or the Victorian Health Department, and with Queensland Health. So they'll be having specific directions provided directly to them by the two health authorities. But I've got to say, my experience with the AFL last year is that they were a model, dealing with Gil McLaughlin and Richard Goyder. They were just focused on doing the right thing. And we're not out of this yet, but we're well prepared. And Australians know how to do this, and governments know how to do this. And so we'll work through this one. There will be at a time when there's roughly 500,000 cases a day, it's inevitable that there will be cases from time to time, and anyone who pretends that there won't isn't necessarily doing a service to the community. And it's important for us in these roles within the community to note we're well prepared. There will inevitably be cases, but we know how to do this. Richard and then Liam. No? Liam.
Minister, we've talked about a slow and steady vaccine rollout, which Australia is well positioned to do. Does the fact that Queensland's now in lockdown show that perhaps we should have acted with more urgency and got more needles in people's arms?
Well, what we're doing is we're distributing everything that we can. So supply is dictating the availability, and I would just note that already we've distributed over 106,000 doses to Queensland, and to their credit, they've already administered 59,000 of those. So there's a significant amount which has been distributed just to that state, that one particular state authority, another 65,000 coming to that state authority this week. So 106,000 already distributed, 59,100 administered by the Queensland government, and another 65,000. So the interesting thing here, of course, is that many people thought, well, we should just get our vaccines from overseas. We didn't trust that supply. And I remember the discussions in August last year. There were those who said, particularly when we were talking with different companies, no, we'll deliver. And we didn't know what the issues would be, but we just presumed that in an uncertain world there was a risk, and that's why we developed a sovereign vaccine manufacturing capability. And that's why people like Dr. Nick and Joan and Kaching, who are here, are able to administer vaccines because we developed the CSL capability as well as the international supplies. And we've had international supplies. Yep, there's been significant disruptions to the international supplies, as we see right across Europe, as we're seeing in other countries, but we have the security, and what that security has done, as these suppliers has come on board, we've been able to almost double our vaccinations in 1 week, and we'll continue to grow at a rapid pace. Now I think also there's Pat.
The initial target was 4 million vaccines by the end of March. what's your current best guess, and will we have even passed 1 million by then?
Well, I think what we'll see is that that of course was dependent upon 3.8 million units coming from overseas. On January the 25th we revised that. Sometimes that January 25th revision is lost in the discussion, I'll put it that way. So that's well over 2 months ago that was changed on the basis of a massive global supply disruption. And that was before Europe began to block the distribution of vaccines. So we'll see how the general practice rollout goes. Frankly, this last week was better than my best hopes, given the supply challenges in terms of actually, literally, physically getting it to people in parts of New South Wales and Queensland because of the rains.